Hi everyone, my name is Cruz. I'm a nurse consultant and manager of the Alfred Health Continence Service here in Melbourne, Australia. I'm presenting research that we completed with professors from La Trobe and Monash universities. I have no financial relationships or affiliations to disclose. Urinary incontinence is a common complication after stroke. A study from a stroke registry in London showed it occurs in approximately 40% of survivors within the first 10 days after their stroke. The pathologic mechanism is thought to be that stroke would disrupt the network of brain regions that have a role in urinary continence. Several studies have demonstrated that electrical stimulation with non-implanted devices may be used to improve the neural control of the bladder and pelvic floor. This therapy can be applied in one of two ways. First, it can be applied transcutaneously, whereby adhesive electrodes are attached to the skin to deliver electrical stimulation. Or the second way is to apply it percutaneously, whereby a needle electrode is used to deliver the electrical stimulation closer to the nerve. In the process of evaluating evidence to support the use of these therapies for our patients, we found that studies have used varying protocols. This led us to ask the question, what is the effect of frequency of therapy sessions on the effectiveness of non-implanted electrical stimulation in treating post-stroke urinary incontinence? We aim to do a systematic review and plan to do a meta-analysis if there were enough clinical trials. We developed a study protocol based on the preferred reporting items for systematic review and meta-analysis protocols, or PRISMA-P, and the Cochrane Handbook for systematic review of interventions. The protocol was prospectively registered on Prospero. Searches were conducted in Medline, Embase, Cochrane Central Register of Controlled Trials, the Physiotherapy Evidence Database, or PEDRO, and CINAL. No language restrictions were used. The titles and abstract screening, as well as the full text reviews, were performed by 2 independent reviewers, and disagreements were arbitrated by a 3rd independent reviewer. The reference lists of all included studies were screened to ensure we did not miss any study. The quality of each study was assessed using PEDRO scores, and we used RevMan 5.4 to analyze the data. The search strategy enabled retrieval of 5,043 records. A total of 212 records were included in the full text review, and 10 were found eligible for inclusion, enabling the analysis of N equals 894 participants. In terms of quality, the PEDRO scores ranged from 5 to 8, suggesting they are fair to good quality RCTs. Majority of participants had ischemic type of stroke. The mean age of participants ranged from 38 to 67 years, which is younger than the typical age range of stroke survivors, which typically is between mid-50s to mid-80s. This is a key limitation of the evidence that we found. The 2 electrical stimulation methods that were reported in studies were: 1, the TENS electrical stimulation, which is used in 5 of the studies, and electroacupuncture, which is used in 5 of the studies as well. One of the 10 studies, though, did not have results that could be used in the meta-analysis, leaving 9 studies for the meta-analysis stage. Percutaneous tibial nerve stimulation, or PTNS, was not used in any of the included studies. So this was found to be another limitation of the evidence base. In terms of TENS, heterogeneity was high when all data from 10 studies were pooled, with the I-squared as high as 95%. This was reduced when the studies were grouped by frequency of therapy sessions per week, whereby the I-squared reduced to 69%. The meta-analysis showed that TENS had a large effect on post-stroke urinary incontinence when it is performed daily, with the standardized mean difference of -3.4. And the effect is only a medium when the TENS is performed less than daily. When it came to electroacupuncture, Heterogeneity was also high when data from all studies were pooled, with the I-squared as high as 94%. This reduced when studies were grouped by the number of therapy sessions per week, bringing the I-squared to 62%. The meta-analysis showed electroacupuncture had a large effect when administered daily or more than 5 times per week, with the standardized mean difference of minus 2.32. The effect is only small when administered 5 times a week, with the SMD of minus 0.44. There are not enough studies to find the SMD for less than 5 electroacupuncture sessions per week. So it appears that both daily TENS and electroacupuncture more than 5 times per week have large beneficial effects on post-stroke urinary incontinence. And these results resonate with the findings of the study by Chipchase, Chabron, and Hodges in 2011 that increased time course of peripheral electrical stimulation is associated with cortical plasticity. Also with findings of Meeson and colleagues in the same year that daily TENS for more than 3 weeks generated persistent neuroplastic changes in the cerebral cortex of healthy volunteers. It would be interesting if brain imaging was used as an outcome measure to see if there are actual changes in brain regions known to have a role in urinary incontinence to deepen our understanding of the mechanism of action of these therapies. There are significant limitations in the evidence available, and the limited evidence suggests a promising treatment effect. Further investigations in randomized controlled trials are therefore required before recommending the use of these therapies in routine post-stroke care. Thank you for listening. Please feel free to contact us via the email address on screen if you would like to discuss further. And I hope you are enjoying the ICS conference.